Welcome back. Right now we are going to focus on healthcare, and over 250,000 Americans every year have to declare bankruptcy due to excessive healthcare bills. Here to tell us more about what we can do is Andy Schoonover, CEO of CrowdHealth. Andy, thanks so much for being here. How are you today?
Doing well. Thanks for having me.
So Andy, you personally struggled with this issue. Tell me more about that.
Yeah, a couple of years ago, my family, my wife and two girls were on a plan that we got on healthcare.gov. We were paying about $1,200 a month for that. And soon after getting that plan, my little one, who's 1 at the time, was having recurring ear infections. And so we went to the ear, nose, and throat doctor, who told us that she needed to get tubes in her ears. So we went to the local hospital. It was about a 15-minute procedure, and soon thereafter got a bill, and it was for $8,000. And I was a little blown away by the amount, but I was even more blown away that my health insurance plan said that they weren't going to pay for it because it was medically unnecessary. And so I had to write a check for $8,000 to my local hospital. And so I called my health plan. I said, I quit. If you're not going to pay my bills, I'm not going to pay your bills. And since then, I've built some tools that have allowed our family to save about $10,000 a year by operating or paying for our healthcare bills outside of the health insurance system. And so I started a company called CrowdHealth to help other families do the same.
You know, many individuals do struggle with paying their medical bills and fall into deep, deep debt. And so that's why you decided to start this company. Tell me a little bit more about this problem.
Yeah, and so what we're seeing here is that deductibles are rising pretty significantly. If you are looking for health insurance nowadays, for a family of 4, it'll be $6,000, $8,000, $10,000, sometimes $12,000, which means that you have to come up with that amount of money prior to the health insurance plan paying anything. And most families don't have $6,000, $8,000, $10,000 for a health event like tubes in her ears, which is pretty innocuous and pretty random. And so, you know, I always tell people, if you don't have enough money in the bank to pay for your deductible, then you're actually paying for something that you can't use very well. Because the whole point of health insurance is to keep you out of financial distress if something big happens. And if you have a huge deductible, like most plans do nowadays, that's really hard.
And you are utilizing technology to help cut down on the middlemen and to really find some reasons to be able to help individuals who struggle with medical debt.
Yeah, so, you know, we, like I said, we provided some tools that allow people to operate outside of health insurance. And so we offer unlimited virtual health. We've gotten, as a nation, pretty comfortable with talking to doctors over the web now. So we have unlimited virtual health. We have significantly reduced prescription drugs. We actually help you negotiate your bills as well. So in my case, we would probably be able to get that bill down by about 50 or 60% by negotiating it. And maybe most importantly is we have a community of people that are willing to help you with those bills. So you can think of us as almost like a GoFundMe for healthcare bills. If you have a big bill, we have a community of people who are willing to help you. And if one person in the community has a big bill, then you can step up and help them. So we're really kind of bringing community back to healthcare.
And what can users expect if they join CrowdHealth?
So what we ask you to do is contribute about $175 a month if you're between the ages of 6 and 54, a little bit more if you're older, a little bit more if you're younger. And that account is yours. And so if somebody in the community has a big health event, you can use the money in that account to help them with that big healthcare bill. And if you have a big healthcare bill, then others in the community will use the money from their account to help you. You know, we've been doing this for thousands of years. If somebody within the community gets sick, others within the community step up to help out. And so we're getting that health insurance plan out of that community and building a community of trust that will allow people to viably pay for these healthcare bills.
And Andy, where can we get more information about all of this?
Yeah, you can join us at joincrowdhealth.com. We're also on all the major social networks, so Facebook, Instagram, LinkedIn, Twitter, at Join CrowdHealth.
Well, thank you so much, Andy Schoonover, for joining us today. Really appreciate this important discussion about revolutionizing and reimagining our healthcare using technology through CrowdHealth. So appreciate your time today. We'll be back with more right after this.